All right. Good afternoon. Good morning, everyone. You're welcome to the Strategic Health Purchasing Changing the Conversation session of the Africa Health Agenda International Conference for 2021. And wherever you are in the world, we're happy that you're able to join us right now. My name is Oludare Bodurin. I'm the program manager for Strategic Purchasing Africa Resource Center, and I will be your humble host for this event. And just to run through a few housekeeping rules, just to make sure that you have a very sweet experience. Thank you so much for being here. We hope that you will come here ready to engage as we change the conversation around strategic purchasing in Africa. We require your online participation. This is going to run from 3:15 East African time to 5:15 p.m. East African time. And we promise that these 2 hours will fly away very swiftly because it's going to be quite engaging. Just a few technology guidance. There's an interpretation button for us to switch between French and English. We have French interpreters on the interpretation channel, so you can select the preferred language as at when due as it goes on. We advise that you put your mobile phones on mute so that you are not distracted. You can use the chat box or the Q&A button to actually type in your questions, or you raise your hands and we can give you the audience to speak to your questions. In terms of participation, we encourage that you come prepared to learn and contribute, not just listen, but also share, add value, add some inputs based on your opinion. We ask that you stay physically present. I mean, this is a virtual meeting, but we ask that you are here and so that we can be sure of your engagement. Feel free to share this session highlights on social media. Use the hashtag Changing the Conversation and AHIKE 2021 as the official hashtag. Just a quick run through for our agenda. We are looking at starting off with a very beautiful spoken word session, and then we will introduce to you what exactly is Strategic Purchasing Africa Resource Center, its mandate, and what exactly does strategic purchasing mean. We will get into some of the work we have been doing about the value of evidence in influencing policy reforms and decision making at the country level. And then we'll get into a fireside chat with our high-level distinguished panelists who will be sharing from their experience as policymakers on what has shifted on strategic purchasing in Africa. And then we will take in your questions and we will synthesize key messages, and and that will be the end of the session. I can promise you again that it promises to be a very, very engaging session. Let us start this meeting today with the spoken word session from El Shafan and his friend. And as they start, I will leave you with this note. Let us be the light throughout the tunnel, for vision requires no less.
We're not here for a good time. No, we're here for We're not here for a good time. No, we're here for a long while. Yes. And we shall fan the flames until the picture frame speaks of generation saved and destinies tamed. We are the spark that will save the day and make the night bearable for all to say Africa is alive and changed. 2 years ago, we purposed and concluded that strategic purchasing is the direction. Yes. After all, decisions we make determines who lives and who dies, who has relief and who is in pain. Decisions we make determines which will hold true, life or death, pain or relief. 2 years and a pandemic later, truer words could not have been spoken. I mean, who knew?
Who knew?
Who knew? I will tell you, we did.
We knew the importance of prioritizing primary health care.
Yes, we knew the uncertainty of life required us to take the path, to take the arduous but necessary journey of universal health coverage. COVID-19 was just the villain that we didn't expect, but we anticipated the need to prepare for one. For though government involvement has increased,
naturally,
primary health has declined because many of us were caught on the back foot. Malaria, cancer, and other very notorious culprits are not sitting on the bench because of substitution. No, they are alive and well in the playing field, waiting for their chance to undo our goals. Furthermore, the systems haven't changed that much, therefore the outcomes might be the same. Moreover, the resources are limited, therefore the calculations needed still face a cruel fate. But I am not here as a bearer of bad news. In fact, I am a messenger of hope. Because it has been 2 years, but we have seen the overwhelming response to the cause we are here for. Because we understand that it is time to stop planning for the people on the seats we sit on today.
Tell them.
Yes, and it's time to plan for those who will sit on them tomorrow. If not to afford them the luxury of new problems other than the typical, let us at least give them the right momentum that will take us to the next level. When we set out to spark the change, we not only knew that this vision was practical, but we all, as sons and daughters of this continent, embraced the charge as personal. It is with this that we have seen the beginning of a new movement across Africa, a new movement across Africa, a movement of individuals in stakeholder groups across sub-Saharan Africa who have begun and are continuing to understand, to talk about and advocate for the better use of limited resources for universal healthcare. It is with this that we are here to give a second wind to this movement, to be louder, to be braver, to be more audacious. We're not here for a good time.
No.
We're here for a long while.
Yes.
And we shall fan the flames until the picture frame speaks of generations saved and destinies tamed.
Tamed.
Yeah, we are the spark that will save the day and make the nights bearable for all to say Africa is alive and changed. That is why we're here to change the conversation. Indulge me, if you will. Do we really need to hear the statistics again? Not like really, do we?
No.
So what do we want to hear? What music do you want the kora to play? You know, what do you want the winds of Sahara to sing? What tune do you want the Nyatiti to muse on? What progression do you want the African people to dance to? Yeah? You and I are tired of such statistics. So what do we want the statistics to be? Change the conversation. No. It is not about how much money you spend on samosas in the streets of Nairobi. It is how much samosa you can get for the money you have. It is not how much money you can spend on a night out in Lagos. It is the quality of time you will get for the money you have. It is not about the money you spend on a meal in Ethiopia. It's the amount of flavor and presentation you will get for the money you have. This base is how we're going to get the best out of everything that we already have. And then every other addition will fall into place into a foolproof system of quality control. Change the conversation. Our main concern is not schemes or programs. It is decision making on what to buy, who to buy from, and how to pay. Our main headache is not more money for health, although we could always use more. Yeah? It is efficiency in our systems. Our main aim is not to point out mistakes, is to always be aware of the stakes. Our main objective is not to condemn, but to redeem the narrative. Our main reason to be here is not to mark out a key performance index. Instead, it is to change the indices of our trajectory. This means we're here to build our community, not just for us, but for the generations to come. Meaning, we are well aware that we might not see the fruits of our labor, but we're also present to the fact that if we do not act now, the scene will not evolve and a story will not resolve to move forward.
We are not here for a good time.
No,
we are here for a long while, and we shall fan the flames until the picture frame speaks of generations saved and destiny stained. We are not here for a good time.
no,
we are here for a long while, and we shall fan the flames until the picture frame speaks of generations saved and destinies tamed.
we are the spark that will save the day and make the nights bearable for all to say Africa is alive and changed. We are the first line of defense. The future comes with possibilities, and we let the economists focus that. But we, as a first line of defense, know it too comes with the certainty of failure if health is jeopardized. We who see the potential of no strategy, we who see the promise of tragedy if we continue with business as usual, we who see the assurance of regret if we do not steer the attention away from the mistakes of the past. We, as the stakeholders in this moment in history, we can't control each element of life, but we can at least build a support system that is tailor-made for it, tailor-made for Africa. That is why we here at Spark start by coaching and mentoring a group of experts across the continent. Then we engage to establish a connection with the different countries to build a lasting platform where we exchange implementation stories and learn from one another. We have seen a 500% growth in the force membership community. We're here to ask for 500% more, 1,000% more, 10,000% more. Africans working for Africa. Our coaching stories can be heard in Burkina Faso, in Rwanda, in DRC, Nigeria, South Africa, and Kenya, working side by side with country partners and leaving behind sustainable change. These are the stats that we want to see and hear. Today, let us be the light throughout the tunnel, for vision requires no less. Let us be the light throughout the tunnel, for vision requires no less. I place the lives of all the sons and daughters of this continent in your hands. Don't stress. There is a plan. There is a strategy. And while there will be a cost to it, in the end, we will say, because of the decisions we made, we are blessed. Because we are not here for a good time. We're here for a long while. And we shall fan the flames until the picture frame speaks of generations saved and destiny stained.
We are the spark that'll save the day and the nights for all to say.
We are the spark that will save the day and the nights for all to say.
Free, 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 Africa, free, free, Africa, free, free, Africa, free, free, Africa, free, free, Africa. Free, 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 Africa, free, 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 Africa, free, 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 Africa. Free, 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 Africa, free, 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 Africa, free, 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 Africa. Free, 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 Africa, free, 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 Africa, free, 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 Africa.
We are the spark that will save the day and the nights for all to say, Africa's crown has been reclaimed.
Wow, thank you so much. That was really wonderful. And I believe that we all enjoyed that beautiful session. I think with that, I can pretty much say, okay, we're done, let's go, but we are just beginning. And just to take us to the next session, I would like to invite Cheryl Cashin. Cheryl is the Managing Director for Results for Development, and she will be taking this conversation further into really showing us what does Spark do and what exactly are we saying when we talk about strategic purchasing. Cheryl, over to you.
Thank you so much, Dare, and good afternoon, everyone. What a tough act to follow. But I think we can all say that we want to be just committed to this idea of strategic purchasing, not as a technical issue, but as a profound commitment to serving the people that we are asked to serve and to using the limited resources that we have in the best way for them. So thank you to those poets. We do want to introduce this topic further, this topic of strategic purchasing that we at Spark are so passionate about. And we have to confess, in the early days, we had some trouble communicating what this is. What is strategic purchasing? It sounds so technical, but in fact, it's common sense. And it's even more than common sense, as you heard from our poets. It's a belief in a better future. But let's talk a bit more about the tools and decisions that we have to set the stage for the conversations about evidence. And no one can explain this better than Spark's Executive Director, Nkechi. So I want to invite you all to have a few moments to see a video that she created to continue to share how we view this topic and how we think strategic purchasing is such a powerful tool. And we hope after watching this video and joining the session that you will all be able to help us communicate this and spread the word and spark the change. So over to the video, Dare.
What comes to mind when you hear light a spark? Is it a dark room that suddenly comes to life, or an ember burning, flickering away in the night? Well, at Spark, we're a little of both. Lighting up the world with the gospel of strategic health purchasing, and we're also there for the long haul, consistently preaching efficiency and more health for the money, just like that ember burning away in the night. With our Spark, we've been able to create a movement and set Africa on fire for strategic purchasing. I'm going to walk you through a practical example of what it means to strategically purchase, even in your own life. And so we'll take the example of you wanting to buy a television. You can just decide to show up in the shops, in the market, wherever it is that you will buy a television, and then just point at one and ask, how much is it? They tell you how much. If you can afford it, you pay. If you can't afford it, then you buy the one that you can afford. That's one way of doing this. Another way of purchasing this television is to get your research done ahead of time. And so you have a beautiful spreadsheet that speaks to models that you would be interested in, that speaks to functionalities, that speaks to different things that the television can do, the prices, comparison, this market versus that market, thinking about how can I pay for it? Should I be able to pay for it all at once, or should I pay for it, over a period of time, like a lease kind of conversation? So if you decide to go the second way, then you have all the information. You get to the market, you get to the shop, and you can actually negotiate for what you want. Now, with this example, I've given you a practical sense of what it means to purchase passively and what it means to purchase strategically. The first example is, of course, the example of passive purchasing. This person just uses a predetermined budget. He knows this is how much I have to spend, and he goes all out to spend it. He just pays bills. That's scenario one. But in scenario two, you have the strategic purchaser, someone who is interested, invested in making sure that he gets the best buys. Now, that is what strategic purchasing is. Utilizing information to make those critical decisions about what to buy, who to buy from, what to pay, and how to pay. That conversation on strategic purchasing is even more critical today. Why is that? Because we know that donor funds is reducing. And so countries are having to dig deeper inside to think about where to get and how to focus on domestic revenue for health. However, while we're doing all of that, it then shows that the little amount of money that we have, that limited fiscal space, we need to make sure that what we're spending is going to where we're going to have the best impact, the most impact on health for the population. That's our day job at Strategic Purchasing Africa Resource Center, SPARC. We support countries to do this in their everyday lives. At SPARC, we have 3 main pillars that we use to do our work. The first pillar is called coaching and mentoring. With coaching and mentoring, we are working with leveraging expertise that already exists on the continent. And so we work with these different experts in different areas of health system strengthening, providing, and also be able to inculcate those soft skills that are very necessary for health system reform work on the continent. And then working with them to be able to then specific country contextualized support to different countries based on their needs. So that's the first pillar, coaching and mentoring. The second pillar is country engagement. And so with all of these experts that we have engaged, whether they're institutions or individuals, then we match them to country demand. And so depending on what a country has come to say, this is my challenge, this is my problem, we'll find the right experts that have the right relevant experience, and we kind of match make them to be able to work together. And finally, we provide a platform for all of this different work that we do, for experience sharing, for peers to review what others have also done and be able to make comments as to how that helps our continent. Now, what exactly is it that we've been able to do in the past couple of years that we've been around? Well, we'll show you. Take a look at our summary of Year 2 achievements.
Great. Thank you so much, Cheryl. Thanks a lot, Nkechi. I think that has, pressed on further into what we stand for at SPARC and what we are positioned to achieve on the continent of Africa. Let me invite Agnes Manua. Agnes is Senior Programs Officer for Results for Development, and she will be taking us further into what we have been doing as far as evidence generation with technical partnership is concerned. Agnes, you're welcome.
Thank you, Darren, for that introduction. And thank you to Cheryl and Nkechi for setting up the discussion so succinctly. So today I have the pleasure of sharing SPARC's work on how we're generating evidence of strategic purchasing with a consortium of 11 technical partners who cut across common silos on the continent, bridging the Anglophone and Francophone Africa and bridging East, Western, and Southern Africa. And what this map shares with you is the location of our 11 technical partners who formed the consortium that was established in 2019. And really, when we started SPARC and the technical partners, one of the things that we came together to do is to, one, develop a common language of strategic purchasing, and to co-develop a strategic purchasing framework that identifies the key drivers of strategic purchasing. And these include, well-developed purchasing functions of benefit specification, provider payment, monitoring, and contracting, and ensuring that these functions are supported by enabling regulatory institutional framework that we can link to achievement of health system results. So we use this framework, more importantly, to conduct a functional mapping of the purchasing functions, capacities and governance arrangements of the main purchasing arrangements in 9 African countries where their technical partners are situated. So the framework goes beyond models and schemes to give a system view of health financing across schemes to identify what is working, where, and why. And this was not just an academic or technical exercise, as interesting as it sounds, but rather it was an opportunity for our technical partners to bridge technical discussions with the policy or political perspective in their countries. And they did this by first bringing stakeholders together, creating a common or shared understanding of the purchasing arrangements in their countries, what is working, progress being made, and what is not working, opportunities for investments, for improvement. And this functional mapping was also an opportunity to bring the stakeholders together to foster and drive conversations in country and to depoliticize what can be very political discussions, as we heard earlier, making decisions on who lives and who dies, if we were to dramatize it in that way, and how to best use health resources by bridging policy and technical discussions. And so what we've done with our technical partners is generating evidence and also beginning to show or to draw out these linkages between what we talk about purchasing functions and improvements in service delivery and health system objectives, and to inform a continued agenda for further improvements. And many of you may be asking, so what does this mean about, which countries are showing progress in strategic purchasing? Where are we seeing links between the strategic purchasing or purchasing functions and also improvements in service delivery? And this map tries to do that. And I'll not go into all the examples, but we're seeing that, just picking a few from East and West Africa. So for example, in the Benin, they defined a purchaser provider split for a new social protection program as a first step in creating clear mandates for purchasers and providers, but they still need to work on the power imbalance between these two. And in Kenya, we see that we have had many reforms related to health financing with the best intentions of improvement in service delivery and access, but sometimes because of unintended consequences during implementation, it threatens those gains that are being made by these improvements. And so what we're saying is that this functional mapping was a way to start a conversation, to start dialogue with our policymakers. And so what we hope to do in the next session is to hear more from the policymakers and hear how these policy discussions are playing out in countries. So without further ado, I want to hand over back to Dara, who will introduce Nkechi's session. Thank you.
Thank you very much, Agnes. Quite a lot of work in the last, from 2019 till now, and we have just started actually. Moving it further, we would get into what I call the meat of the discussions, taking this discussion directly to the seats of the policymakers as we continue in this conversation. And you have heard the voice of Nkechi, but now you are going to hear a live voice of Nkechi Olalere. Once again, Nkechi is the executive director for SPARC. So I'd like to welcome her to take on this conversation. Welcome, Nkechi.
Thank you so much, Dari. And it is really exciting to be here and to have this conversation with everyone here. Thank you, Agnes. Thank you, Cheryl, for the great intro to this conversation. I'm really looking forward to taking that further. So our discussion today is going to be with a panel of policymakers who are going to tell us a bit more about how they're practicing, utilizing strategic purchasing concepts in their different countries. But before then, perhaps a little intro. The poets, a tough act to follow, I absolutely agree, have sort of laid the groundwork for the conversation we want to have. Over the past 2 decades, we've actually seen that there has been an increase in financial commitments by governments to health in low and middle income countries. However, more money for health does not necessarily translate to better outcomes, especially if they're not spent efficiently. And that's where strategic health purchasing comes in. That efficient use of limited resources to ensure that we get the best health outcomes for the population. And so it really involves all of those decisions that we talked about, what to buy, who to buy from, and how to pay. Really making sure that we're getting the best quality services, especially for priority populations like the poor and the vulnerable. Again, as the poets have said, because you're talking about prioritizing, essentially these decisions could mean life and death for the people who are involved. And that's really everybody, because we're all affected by these decisions. The trade-offs are also not easy. when you think about the increasing demand, the increasing need for primary health care, and that competing with the fact that a lot of governments are really excited by and focused on very expensive tertiary care. And then you also think about the fact that, yes, while we do have increasing financial commitments to health, even in the midst of the fact that we know that it's still not enough. If we use the Abuja Declaration, not too many countries have actually met that 15%. But then you have that increase in funding competing with people also demanding an expanded benefits package. So it's a very tough one for policymakers to navigate. And then add to the mix COVID-19, which has further contracted an already small fiscal space. That's why for us, strategic purchasing is not just an option, it's not just a choice. It's almost like something that has to be done. It has to be done, and it has to be done now. At Spark, this is our reason d'etre. This is the reason why we wake up every morning and we go to work, supporting countries to make those key decisions using very limited resources. And at Spark, we're also focused on how this approach is provided. It's the soft skills needed to navigate those political economies that we talked about. And so at Spark, we're as much about our technical mandate as we are about the way that we provide the support. And so today, to discuss this, what has happened 2 years since the last Africa Health Agenda International Conference, 2 years since the launch of Spark, what has changed in the strategic purchasing ecosystem? And to do justice to this conversation, I have four distinguished policymakers to discuss this with me. First, I have Nat Otu. Nat is a senior fellow at R4D, and he was also the pioneer executive director for Spark and former CEO for Ghana National Health Insurance Agency. Nat is a health systems and public policy consultant with over 11 years of work experience in health insurance implementation. He has contributed to and supported numerous global, regional, and local UHC activities and events. As a founding member of the JLN and later AIDS First convener, Nathaniel has supported JLN, and he's also a member of Duke University Launch and Scale Speedometer Advisory Board, and also serves on several other boards. Please join me to welcome Nat. You're welcome, Nat. Moving very quickly to the very next panelist, I have Dr. Parfait Owaliraye. And having pronounced the surname for the first time, I shall not be repeating it again for fear of murdering it. And so you're welcome, Deji Parfait. Deji Parfait is the head of planning, monitoring and evaluation and health financing in Rwanda's Ministry of Health. This is a position he has held since November 2012. He's a medical doctor. He's worked as a research assistant, district medical officer, and a director of Kibagabaga District Hospital before he joined Ministry of Health. Special interests are health policy, planning, health financing, private sector engagement, and of course, global health. You're welcome, Deji Parfait. Then I have Dr. Nneka Orji, who is the technical assistant for the Minister of State for Health in Nigeria. Nneka originally trained as a medical doctor and practiced clinical medicine for a few years before she caught the bug for public health, where she has supervised several projects and traveled to over 25 countries in the world. She is currently a PhD candidate at the Menzies School of Medical Research, University of Tasmania. Nneka enjoys hiking, apart from her work in the global health world. And definitely, and last but definitely not the least, Dr. Pierre Yameogo, who is the Technical Secretary of Health, Burkina Faso, medical doctor, public health specialist, and technical secretary in charge of universal health coverage and One Health at the Ministry of Health in Burkina Faso. He supports the effective coordination of interventions, promoting strategic purchasing mechanisms within the country's Ministry of Health. So you're very welcome to all the panelists, and thank you so much for being here. So we'll kick off the conversation with Nat. We've talked about this political environment in which conversations on strategic purchasing happen, with different stakeholders having different opinions on what to buy, who to buy from, and how to pay. So policymakers face a wide range of challenges and choices when they think about the underlying political economy in their different countries. So my question for you, Nat, because you've kind of worked in that intersection of policy and then also understanding the technicalities of the work that needs to be done. How would you describe the political dynamics of strategic purchasing, and how can a policymaker be equipped to address this? Nat.
Thanks so much, Nkechi. I liked, a statement that was made yesterday during the opening session. I think it was by the Kenyan Minister for Health, and he said that to be successful in, health system strengthening and moving towards UHC, we must align policy to politics. And that's exactly the point that you've made, Nkechi. How do you do this alignment? Because if you are very, high on politics without policy, you are bound to fail. And if it is the opposite, you are bound to fail as well. The one thing that I recognize a lot of policymakers shy away from is to deeply understand politics and to leverage it, for policy making. And I think that in the space of strategic purchasing, this is more important for us to focus on, because, decision making, to move towards strategic purchasing is fraught with a lot of tensions. This is because it's essentially about the allocation of scarce health resources, which determines who receives services, where and how, our populations receive those services. Number two, who delivers the services, and what is the optimal mix of those services, and what are the quality requirements for those services? And then after that, how do we pay for those services, and how is accountability for outcomes allocated between stakeholders? Now, you would realize that in this space, there is something very critical, because strategic purchasing, just like many other policies, is a function of four things. One, every stakeholder wants to maximize their benefits and minimize their risks. And so if, for example, you want to expand the benefits packages available to the population, certainly the population wants a bigger benefits package, but the purchaser probably wants to, optimize and minimize their risks in that regard. Then there is the desire to minimize the complexity of implementation. So in a country like Ghana, for example, most recently, when there was the introduction, of a mobile platform for people renewing their health insurance, membership, it caught on, and membership has grown by leaps and bounds. Thirdly, every stakeholder wants to simplify how their performance is measured. So they want to be measured in as simple a way as possible, in a way that doesn't take away a lot of their time and resources, which are already scarce. And number four, above all, is how do they communicate these interests that they have, around the table in as succinct a way as possible to be understood. And so I'll go back to my days at Ghana's Health Insurance and recall that when we tried to change one of our provider payment methods to move from DRGs to capitation, the question became, who is losing and who is gaining, and what are the risks that we need to mitigate? And the question was, is capitation too complex? Is it going to affect the resources and the time of the healthcare providers? Then how are we going to measure? And so when I've paid you money upfront for delivery of services to a guaranteed population, how am I able to say that the services that I want are being rendered to the quality standards that I want? And fourthly, how have we communicated? So when we started off with capitation, the one thing that we realized was that communication was really very difficult, and it remained mostly at the technical level, but it needed to be broken down to the common man's level, because the ordinary citizen is the person for whom the services are going to be rendered. And so these are things that, again, should occupy our attention a lot, because without these key things, without these key issues occupy our attention, we will not be able to formulate and implement strategic purchasing decisions. And therefore, I would say that our inability to surmount these tensions are one of the things that sort of impede our successful implementation of strategic purchasing reforms in a lot of Africa. But recently, there has been quite a lot of traction on the continent to move towards this. And some countries have been very bold, have probably mastered the technical issues involved, and have made very bold decisions to actually implement strategic purchasing reforms. And I remember in Kenya about 3 years ago, the cabinet secretary, who is the Minister for Health, specifically stated that Kenya wanted to move towards strategic purchasing by reforming its health insurer. And in Rwanda, I believe very definitely written in their health financing policy is the fact that they want to move towards strategic purchasing, realizing that resources are scarce and they have to be used efficiently. And so what we want to do is to always try to focus strategic purchasing decisions, one, on the benefits to the ultimate consumer, because that's the person we are working for. And how do we strengthen the capacity of stakeholders to implement policy, set up transparent processes, generate evidence to monitor performance, and then overall achieve stronger and sustainable health system that guarantees customer satisfaction. And also making sure that every decision that is taken to reform policy is done at the right time. So in Ghana, when we try to implement capitation, it came around the time of a political election, and it wasn't the right time to do so. And so all these little things that we might gloss over are key things that makes us successful in implementation of strategic purchasing policy. And I remember clearly that President Uhuru Kenyatta said yesterday that we must build political will and political commitment for reforms in our health systems. And this clearly applies to strategic purchasing. Again, I would say and conclude that we must align policy to politics. Thanks, Nkechi.
Thank you so much, Nat. I could sit down here and take notes the whole day. Thank you. There are so many things that you said. Some of the key things for me that are really standing out is the fact that communication is so key to strategic purchasing reforms, especially communicating the benefits to the ultimate consumer. But then I really love all of those things you talked about, policy and politics. You quoted President Uhuru Kenyatta, who said, to be successful in health system strengthening, you need to align policy and politics. You talked about the political will, but then also the political commitment. And that ultimately our inability to surmount these obstacles is what really leads to challenges in implementing strategic purchasing reforms. Thank you so much, Nat. I will now segue from this particular point to a country that appears to be the poster boy for all things great in implementing strategic purchasing reforms. And so this question is for you, DG Parfait. Rwanda is one of those countries that appears to have the answers to addressing this political economy issues. It would appear that you have both the political will and the political commitment. Your country personifies successful reforms in strategic purchasing and other major reforms towards universal health coverage. I mean, we could give examples from your largely successful CBHI, from the way you were able to align your PBF with your quality accreditation program. The news from Rwanda has always been good. Has been good, especially in recent years. As someone who spent about 2 years in Rwanda, people always ask me, how does Rwanda get things done? And so we have you here today, DG Parfait, to demystify this for us. And so I ask you, how has Rwanda been able to institutionalize strategic health purchasing, whether it's through curating your policies or anything else? We would love to hear from you. DJ Puffy.
Well, thank you so much, Nkechi. Thanks, Nat, for the very good insight. So going straight to the point, as moderator Dr. Nkechi has mentioned, the first thing I would say, as mentioned, for Rwanda, our country, what things are getting done. Number one is what Nat has mentioned. Nat has mentioned a very good point. That's the political will, and also a visionary leadership, which put people first. So from that perspective, having a visionary leadership, we have built our vision around that, and have the people at the center of the development. So considering our development agenda translated in the Vision 2050, having Rwanda with an ambition to become a high-income country by 2050. So development of human capital, it's number one, it's pillar number one. So you can understand that the health of the people is put first. So with that perspective, if you have healthy people, definitely we will have a productive workforce. So that productive workforce, as most of our economy is rely on the service. So the service is about people being productive, good health. So we can understand where strategic purchasing fits very well. So for the how we institutionalize strategic purchasing. Number one, strategic purchasing is one of our priorities in our strategies going forward in our development agenda. How we sat together and see how this can be done, making sure that all the policy, legal framework are aligned with that vision of having the strategic purchasing well institutionalized. By institutionalizing strategic purchasing, what we aim at was putting the evidence in all, as you mentioned right even in the beginning, promoting the use of evidence in prioritizing how to purchase services, how the type of service that we should purchase with the resource that we have. So as the other countries in Africa, we all have the same issue about the resource allocation with a lot of priorities, fiscal space not accommodating all the priorities. So that's how we use evidence to ensure that what should come first. So by institutionalizing, we put or we promote the policy dialogue, first bringing all the people together, all the people working on the strategic purchasing or all the people implementing or designing strategic purchasing came on board. That's mean the Ministry of Health, the purchasing entities, that's mean health insurance. We have also the representative of the people, the representative of the consumers, but the Ministry of Finance, but also other ministries that are having some services that are being purchased in the health sector in one way or another. So we put together that kind of policy dialogue forum where we discuss all the issues around strategic purchasing, of course, using data. And we have the common understanding, the common agreement on what should become first. Number two, we identify something that's very important to see how this can be done. That means the result. What are the expected results if we implement strategic purchasing? The goal or our objective was at least having 2030 achieving the universal health coverage. Just wanted to recall the principle of the universal health coverage. That's access with to services with equity. People are accessing quality services, but as well they're financially protected as they're purchasing services. So that's why strategic purchasing has come on one of the priority. That's why also we are institutionalizing. But in brief, what has driven us about putting strategic purchasing is because people came first. What are the types that people are, the service that people are using, so that we use data. And then from there, we know what should be purchased, of course, with a common agreement, rather than say things, say, that's the Ministry of Health, this is the insurance, just take this, just take this, just take this, as a will of the people. Not, but we put first the evidence. What are the services that are being, highly consumed or are highly utilized by the services? Then we go by prioritization. As we go, as we grow economically, definitely the physical space grows, definitely we'll be accommodating other priority. Thank you very much, Nkechi. Thank you.
Thank you so much, DG Parfait. So there are a couple of things that have come up here for me. So one of the key things for Rwanda is political will, having the political will. So this really builds on the point that Nat had made earlier. You need to have that in order to be able to move forward. And I believe it was President Uhuru Kenyatta who spoke about that yesterday. So that is very critical. You talked about this visionary leadership that puts people first. You talked about the fact that you are institutionalizing strategic purchasing, not just by talking about it, but by writing it into key policy documents, putting it into the agenda that you have for the future. And then you also talked about aligning stakeholders. So different people, different opinions, different thoughts, but aligning everyone behind a common vision of what you want to achieve. That also includes by having policy dialogues. That also includes speaking to the fact that these resources we have are limited, so how do we prioritize what we want to do now, but getting everyone behind that common vision of strategic purchasing for the future. Thank you so much, DG Parfait. Again, we would use this last point to really segue to the next question that I have, and that's for you, Dr. Pierre Yameogo. So I know that one of the key pieces of work happening in Burkina Faso now is really aligning stakeholders behind a common vision of strategic purchasing. But it's interesting because you're also one of those countries that already have recognized the impact of strategic purchasing. And so we know that you're spearheading different reforms in this area, whether it's the expansion of the benefit package for gratuité and thereby increasing access to reproductive and maternal health services, utilizing the private sector to further increase access to services, which is really innovative because lots of governments don't really know how to tap into the private sector. And then also utilizing your community-based health insurance schemes to bring services closer to the people, and more recently kicking off this your very interesting and innovative community health clubs. So my question for you sort of mirrors the question I asked DG Parfait. How have you been able to lead and to sustain these reforms?
Merci bien, Dr. Nkechi, pour cette question sur l'expérience du Burkina. Et je dois préciser que avec les prédécesseurs, il faut un engagement politique fort et un engagement économique pour pouvoir effectivement changer la donne au profit des femmes et des enfants qui représentent à peu près 25% de la population. Et 25% de cette population, sont ces femmes et ces enfants où on enregistre beaucoup plus de décès. Donc, avec le leadership de son Excellence, Monsieur le Président du Faso, depuis 6 ans, en 2016, ils ont décidé de soutenir, de mettre en place l'accès gratuit aux soins pour ces 2 groupes. Et ça fait 6 ans que j'assure la coordination de la mise en œuvre. Ce qui est important à retenir, c'est que le ministère de la Santé a effectivement mis en place un dispositif dynamique et progressif pour que le paquet de soins soit inclus au fur et à mesure. Par exemple, au début, en 2016, en fonction des ressources disponibles, nous avons pu définir un paquet de soins. Après, nous avons ajouté la gratuité de la planification familiale. Après, nous avons élargi au niveau communautaire et nous sommes en train de réfléchir actuellement pour que d'ici la fin de cette année, nous puissions étendre ça aux personnes âgées. Donc, c'est vraiment un engagement fort politique au plus haut niveau. Et cet engagement est le fruit vraiment aussi de la participation de la société civile qui a su faire un lobbying, un bon plaidoyer pour amener les gouvernants à se pencher sur la question. Et je précise que cette politique qui est en cours, c'est après l'insurrection que le pays a connue en 2014 avec le gouvernement de transition en 2015 et ça montre à tel point, effectivement, le pays est avancé dans cette disposition-là. Dans le même temps que nous faisons la gratuité des soins, nous réfléchissons maintenant à un modèle de santé communautaire pour pouvoir agir dans les ménages. Et il faut effectivement promouvoir la santé et un modèle d'achat stratégique qui agit au niveau des communautés a deux intérêts majeurs. Premièrement, ça va éviter d'avoir beaucoup de cas graves de maladies au niveau des hôpitaux et en investissant des ressources financières au niveau des ménages, au niveau des communautés, avec les clubs de santé communautaire, nous réussissons à diminuer surtout les factures de la politique de gratuité des soins. Parce que si on soigne au niveau de la communauté, ça devient 10 fois à 15 fois moins cher que si on soigne, par exemple, un enfant au niveau de l'hôpital. Donc, nous venons de lancer cette réforme complémentaire au niveau technique pour que nous ayons ce que nous appelons des ménages modèles, des villages modèles, des communes modèles. Et ceci se fera à travers la mise en place de clubs de santé communautaires où ça sera des femmes engagées qui vont pouvoir faire des visites à domicile pour pouvoir changer et transformer les ménages. Donc, c'est tout un vaste programme qui va s'inscrire et encore peut-être 3 ans à 5 ans et nous allons de façon progressive et nous allons y réussir. Voilà pour ce qui concerne la réponse que je peux donner à votre question. Merci.
Thank you very much, Dr. Pierre. I think some of the things that really stood out for me is that prioritization is very key for you in Burkina Faso. And this for me is very fascinating. From the time when it looked like countries really wanted to provide everything, even though it was clear that no country has unlimited resources. But it appears that prioritization is a normal conversation, if I might say, in Burkina Faso. And then you also talked about reflections, always reflecting on the model of healthcare that you have and looking at how best it can serve the population. Thank you very much, Dr. Pierre. And then my next question would really sort of take a foundation from provision of services that really speak to the needs, whether of the population or of the countries. And so when Spark was being scoped for, one of the key concerns that we heard from countries was the fact that they wanted a different type of technical assistance. They were really tired of the fly-in, fly-out kind of technical assistance. They wanted technical assistance that was responsible, that was responsive, that was provided by experts who had relatable experience and an understanding of the political economy. I think that if there's one thing that we've really unpacked this afternoon is the fact that the political economy is very key to these conversations. So, Nneka, you wear two hats in this conversation. One, the hat of policymaker. One of those people who said to Spark, we want to have a regional cadre of experts who would respond to our needs with an understanding of the ecosystem. So that's one hat that you wear. But then you also wear the hat of really being deeply technically involved in providing technical assistance. So I want you to tell us a little bit about, as a pioneer member of PAC Community of Health System Strengthening Experts, the FORCE. And the FORCE, by the way, is PAC's initiative to change the face of technical assistance, establishing this sustainable network of regional and country experts in strategic purchasing to support country engagements. Very different from the fly-in, fly-out technical assistance that we're all used to. So Nick, my question to you is this community a useful resource for policymakers who are working on strategic purchasing interventions? Is there any lesson that stands out for you on the peer-to-peer learning that is available there? And how does this support a policymaker in taking decisions? Nick, are you there?
Sorry, I didn't know I was still on mute. So thank you very much, Nkechi, for that question. And also thank you for all the other panelists for also setting the tone of this discussion. So for the question of if this community is a useful resource to health systems across the African sub-region, I want to say absolutely yes. And it can be otherwise. And also to say that it's even more gratifying and exciting that it is coming at this time. And then the paradigm that it is, projecting, homegrown, home-owned, and people who would have relatable experience to the realities of the time. So it can be otherwise. It is, for me, the best thing that would have happened to the African region, especially at this time. The paradigm of strategic purchasing is around efficiency. So we need to be seen to practice what we preach. And so this community has also set the tone for us to practice what we preach in terms of being efficient and purchasing resources, for technical resources for shaping the discussion around strategic purchasing in an efficient way, instead of using the old strategy of getting technical assistance where people will fly in and fly out. So this community has helped to, shape the discussion, considering the fact that they can relate, with the realities of the time. So this community has been of utmost help, immense help to shaping the discussion. But I just also would want to say that all work is not yet done. We've not been able to, or the SPAC or the FORCE community has not been able to reach the entire African region. So there still is a lot more work that needs to be done. But just to say that the momentum has been set and it's spreading like wildfire, and people are becoming more aware, more interested. And the fact that the discussion is becoming, the strategy for the discussion is becoming more deliberate. The targeting is more deliberate. For me, that is one of the things that stands out in the approach, that the community uses, looking at the right people to engage in this conversation, looking at the right stakeholders, and not just that, looking at how to relate with them and how to target them and, take the discussion to their doorstep for that ownership. For me, that's it's a pathway to efficiency. For me, that is a pathway to sustainability, which is what strategic health purchasing is definitely all about. So for me, I think starting the journey was the first baby step, which we have taken. I think having pushed this momentum or having pushed this paradigm, the new challenge will be, look, we need to spread this paradigm. We need to spread this wildfire, which is good. The peer-to-peer learning is also another wonderful approach that is very well targeted. So the people who are experiencing these realities are bringing not just their experiences, but that they're also bringing their challenges to the table. And they are free and safe to bring these challenges without fear or favor. And these challenges are co-identified and tailored solutions are identified for solving this problem. For me, that is really the high point of strategic health purchasing. And that is what this entire community is all about. And that is what is really happening. But I must say that the momentum has to be sustained. The momentum has to even be further targeted, because we've been talking about health purchasing, financing health, and the politics of it. Because if the budget holders or the political class are not part of the discussion, or the discussion is not shaped in such a way that they are understanding it, they are relating with it, they are contributing to it, and they are taking ownership, then work done. I mean, we haven't done anything, we haven't started working. But the fact that the approach of Spark and the FOSS community is embracing all of this identified issue, for me, is the best thing that could ever happen to us, and we must keep the momentum going. Thank you.
Thank you very much, Nneka. So I hear you on the fact that starting off the forts, working together with ACS and Health Systems Accelerator to bring together this group is just the first step. And so for you, we now need to be more targeted and also ensure that there is a representation from across Africa. Because if this group is supposed to support countries with contextual knowledge to really be able to walk through those strategic purchasing reforms or interventions, then we need to have this spread over Africa. So I hear you, Nneka. This is definitely a call to everyone to join the movement as we move forward. Now, this coaching approach that Nneka talked about, which the force uses, is really about people who understand, who use soft skills to support country stakeholders to implement reforms. We've talked about the fact that there is so much politics involved in this conversation. And so maybe just to also look at it practically, because Nneka, you've given us a great overview of how this group works, how you have your peer-to-peer learning and what you're learning from each other. But maybe to then ask practically in country, what does that look like? Dr. Pierre, I'll come back to you to ask this question. So one of the key things that we were asked to support in Burkina Faso was really to align different stakeholders behind a common vision of strategic purchasing. We knew that this was a very difficult conversation, very mired, I mean, quite tense. But there is a Spark coach who is working with your country team side by side, just supporting those conversations. Has that approach been useful in sort of tempering down the politics of those conversations on what to buy, how to buy, who to buy from? Has it been useful in taking away that focus on schemes or programs and refocusing the strategic purchasing conversation on a functional one? Really, those decisions we need to take about what to buy, who to buy from, and how to pay. Dr. Pierre.
Merci bien. C'est vraiment important que ce soit les techniciens ou bien les politiques, que nous parlons le même langage quand on parle d'achat stratégique. Et l'illustration de la vidéo, je pense que je vais demander ça après pour pouvoir expliquer en français facile qu'est-ce que l'achat stratégique. Et je me rappelle effectivement, après la réunion que nous avons eue à Cotonou en 2020, en janvier 2020, dès que je suis rentré de retour, et en faisant le point au ministre de la Santé, le ministre de la Santé a adressé une correspondance à Spark pour pouvoir soutenir le Burkina dans la construction d'un modèle d'achat stratégique. Effectivement, nous avons eu le retour positif et un assistant technique a été désigné, Dr Dossou Jean-Paul du Centre de recherche au Bénin. Et nous avons travaillé d'abord en virtuel avec le secrétaire général du ministère de la Santé et les directeurs centraux pour expliciter d'abord le concept d'achat stratégique. Et après cela, nous avons reçu, j'ai demandé à ce que l'assistant technique même vienne au Burkina et il a fait un séjour de 3 semaines à partir de là pour que, avec la grille d'évaluation des pratiques d'achat stratégique, et moi-même j'ai appris beaucoup de choses durant son séjour parce que en utilisant cette grille qui est vraiment objective sur la gratuité des soins, sur une échelle de moins 25 où c'est mauvais à plus 25 où c'est fort, je me suis rendu compte que la gratuité des soins avait un score de moins 4. Ça veut dire qu'on n'avait même pas 0. Et de façon consensuelle, nous avons établi une feuille de route pour pouvoir identifier les points où c'est négatif, les points où c'est 0 pour que nous puissions corriger et rendre la gratuité des soins encore plus stratégique. Donc, c'est une expérience qui est en cours, ce n'est pas encore fini et très prochainement, nous allons encore continuer la construction de ce modèle. Ce que je retiens de ce mentorat, c'est 2 choses. C'est que c'est pas en fait venir dire comme ça il faut faire, mais c'est du faire à partir de la conviction des évidences que les différents acteurs ont sur le terrain. Donc vraiment, à ce niveau, Spark est très bien apprécié et nous continuons de collaborer pour pouvoir effectivement aboutir à un modèle qui est très, très bien. Deuxième chose que je retiens, c'est que il faut effectivement s'ouvrir à l'extérieur parce que très souvent, on pense que si on reste sur place, on devrait pouvoir trouver les solutions alors que peut-être la solution se trouve ailleurs. Personnellement, j'ai fait beaucoup de voyages d'études. J'étais tout récemment à Kigali, au Rwanda. Parfait, on a beaucoup discuté. Et le Burkina est ouvert surtout pour tout ce qui concerne le partage d'expérience. Ce qui est important pour le ministre de la Santé, c'est de toujours identifier la meilleure approche pour pouvoir y réussir. Vraiment, merci bien à Spark qui nous a permis et nous continuons toujours la construction de ce modèle. Merci.
Thank you so much, Dr. Pierre. I think for me, 2 key points, which are your last 2 points, really stand out for me. That, and it's really buttressing that thing we heard from policymakers, from countries at the time that the scoping for Spark was being done. You don't want anyone to come tell you what to do. No, because in your own countries, you already have experts. You want someone to work side by side with you, somebody who understands your context and then will support you in those reforms that you want to do, because you do know what you want to do, even if the person just works with you to help to actualize that. That's a very important point for country engagement, but especially for us at Spark and how we support countries with the coaching approach. And then the second thing you also talked about is also something that is very important to us, which is cross-country learning. That there is so much that one country can learn from another. I think that during our in-person convening in Burkina Faso last year, before COVID shut everybody down, there was so much happening, different countries talking to different countries. And that's where actually, like you said, we identified this opportunity. And then we had a coach from our technical consortium in Benin go support Burkina Faso. And then, of course, I also met you, Dr. Pierre, while you were in Kigali, having these discussions with DG Pafi. So this is also something that we actively support, Africa learning from Africa. And we can also learn from the global north. But at the end of the day, all of that has to be contextualized for us. So these are two key points for me that I'm taking from this. So thank you so much, Dr. Pierre. Dr. Pafi, I will come back to you. And sort of build on that first question that I had asked Dr. Pierre, where I talked about this different view of strategic purchasing. A lot of times when you say strategic purchasing, people say, oh, that's PBF, or maybe that's CBHI. You have a PBF scheme in Rwanda. You also have a successful CBHI scheme in Rwanda. So has maybe looking at strategic purchasing, not as a program or as a scheme, but more in terms of functions, those functions of taking that decision on what to buy, who to buy from, how to pay. Has this approach helped you in being able to align stakeholders? And then more importantly, has it helped people to better understand strategic purchasing and how it can be implemented? Over to you, Dr. Pafi.
Thank you very much, Nkechi. So as you rightly mentioned, strategic purchasing is a function. So I also mentioned before that the core business around strategic purchasing, what drives strategic purchasing, it's evidence. So evidence has been the motto or the triggering factor for a discussion on strategic purchasing. So you said or you mentioned something about how bring people together. So bring people together, you bring people together with evidence. So data, when you bring data, so everyone understand the data, then you can't you can't go away or reject data, because data show the evidence, what is there on the ground. So, but of course, it's not something just you bring one day and then it's concluded. It's a process. It's a process. That's why policy dialogue sometimes takes longer. But on our case, we build the case. We show the importance of strategic purchasing. We show the people, the data, what's there, what's the idea. I mean, what the issue around, how can we solve that issue. Of course, normally in our culture in Rwanda, we are problem solving. We have problem solving mindsets because of our history. We know that solutions should come from us first of all. Of course, we should look at other ideas, of course, those experience from others. But first of all, we shall discuss and find solution among ourselves. So evidence has come, evidence has come as the driving factor for a discussion. Of course, we bring all the people together. We are not in the same understanding. On the same understanding, we wanted to build. Of course, we go slowly with building capacity for the people, and then you show them how things should be done, but also discussing other ways of solving issues that we have. What should be purchased with what we have. Who should be purchased it? How these things should be purchased? All those things came on the table when we discussed strategic purchasing. Number two, after discussing among ourselves internally, we also bring other people. We all understand the importance of building partnership, effective partnership. That's why it came up. We built a partnership with Spark, with also other institutions, either in development partner here, also outside, of course, with Spark. So that's where we enlarged the group and we started discuss broadly the issue around strategic purchasing. So, and then from there, that's policy dialogue. It's all open up each and every one what should be done, of course, with a clear roadmap, action plan, what should become fast, what should we be doing a specific period of time. So those are the things that we did. The other thing I wanted to mention, it's a journey. Strategic purchasing is a journey. We started, but of course we should be more flexible, but also adapt new, as new evidence has come in, we should also be able to be flexible to adapt with the current issues we're facing. Of course, let me just give an example of COVID. COVID. I assume that after COVID, I say we should rethink the way we are purchasing services. Of course, with how different countries, including ours, has endured this pandemic of COVID. So, but the what should drive us? It's that spirit of frank policy dialogue, but also be accountable one to another. If we are commit something, we shall make sure that it's done. So with the spirit of delivering, bringing the result from what we have been discussing or what we have planned. Of course, we can plan and execute, but it doesn't go well. Definitely, we should adapt and see what are the way of correcting things. But something must be done to ensure that we are making progress. So, in brief, I would say that data or evidence was the triggering factor of our discussion. Number two, building effective partnership with other stakeholders, either in and also out of the country, with what we have, because we all strive to learn, or getting new idea, experience, so that we can overcome our challenges. But another thing that we should be more result oriented. What we have committed should be done in the spirit of accountability. So thank you very much, Dr. Kish.
Thank you so much, Deji Pafe. Starting from the very last point you made, you said strategic help purchasing is a journey. And I love that, because it is. There's this beautiful slide, I think it was Cheryl, I'm not sure who put that up, and it shows a continuum. It's like a journey from passive to more strategic purchasing. And it shows it's about deliberate decisions made on the basis of information. And so you just keep going on that journey to more and more and more strategic purchasing. That was just the vision that flashed in my head once you talked about this, Deji Pafe. So thank you so much. Indeed, we should capture that somewhere. Strategic purchasing is a journey. You've got to be flexible and you need to adapt as you get new evidence. I also really loved the fact that you focused so much on evidence. Evidence should lead the way. As you get more information, you do better. And then you also talked about bringing different people around the table, whether these are partners, whether these are government folks, just having an effective partnership. You talked about this, you talked about those decisions about what to buy, who to buy from, how to pay, but you added something very interesting. You added, of course, who should be purchasing. And so for me, that really speaks, and you talked about accountability. And so that speaks to me about the governance arrangements that are needed for strategic help purchasing. And so Nat, I come back to you and I start with that same premise, because we do know that good governance is required for effective strategic purchasing, steering purchasers and providers towards health system goals defined by health policymakers, and then of course, making progress towards universal health coverage. Now, these governance arrangements will differ from country to country because everybody takes a different path, whether on their journey to different reforms or to UHC. But my question is, are there some common paths to progress? What would you describe as important governance factors, important maybe indicators that we should be looking out for countries to really make progress towards strategic help purchasing? Nat?
Thanks so much, Nkechi. I mean, what we call governance really is about stewardship, and that stewardship for strategic purchasing must be very deliberate. And what I'll do is to probably just characterize this in a cascaded form. As nations and as countries, we have our various aspirations that are expressed in our constitutions and international commitments. We translate these into laws, regulations, policies, development plans, fiscal content, ways of ensuring accountability. And when we come to strategic purchasing, really, it just also distills into how we formulate strategic purchasing policies. How do we moderate the interactions between actors? And DG Parfait, eloquently spoke to that. And also, the issue of aligning strategic purchasing building blocks. So whilst, for example, you are changing, let's say, the provider purchasing arrangement, are you also in tandem changing the contracting mechanisms? And are you broadening or kind of narrowing the benefits package? So they must all be taken together. And finally, there must be advocacy. As you heard, in terms of Burkina Faso, there was advocacy which actually got the minister interested. Then, the minister moved to ask for support and assistance from SPAC. Then, they got to work with Rwanda on this. Now, all these put together should just lead to three things. One, services must become available to our populations of a good quality, equitable, and also efficiently delivered. And there must be a minimization of financial ruin when people seek healthcare, essentially. But what we want to do is to look at those key things that we have to concentrate on. One, a good governance system should be able, or it should allow us to be able to, formulate strategic policy frameworks. Number two, we should use that to provide effective oversight of our strategic purchasing systems. And also that allows us to regulate the whole system effectively, ensuring that that regulation brings about the desired results that we are seeking, or that we seek, for which reason we kind of strengthen our strategic purchasing system. Then again, it is going to look at what are the incentives that will make people work towards strategic purchasing, and also probably sanctions and systems of accountability. But a good system for governing strategic purchasing should have, one, a very clear vision. That vision must be expressed, by defining the problem at stake, the approach to resolving it, and what is the sequencing. Then again, we must have effective consultation, participation, and consensus building. We must bring legitimate partners around the table with the right capacity and information to discuss the issues at stake. And I do remember, during some of the engagements we had in Ghana, some people came to the desk, without the right information, but still they had a lot of sway on the system because of their access to, should I say, mouthpieces, which were pretty loud. Now, there must be accountability, and accountability is our ability to report on performance, to learn from mistakes, and also to build up on successes, and also check whether we are using resources in the approved manner. We must be transparent, predictable, because predictability means we must apply rules in a consistent manner that follows set schedules. We must be evidence-based. This has been stressed, 100 times, on this conversation. And then we must be, sustainable. But whilst we are talking about sustainability, we also realize that there is the importance of always demonstrating quick wins. So if you're in the policy environment, then you want to segregate what are the quick wins and what are the long-term things that you want to do. And finally, there must be confidence to make decisions and have a quick turnaround. So as those people, the partners involved in governance, do they have the right capacity to take decisions to further strategic purchasing? Now, on top of all that, as I said in the beginning, and everybody has alluded to, we are dealing with people, who have, should I say, political power. But people who have political power have one currency, and I call that currency political capital. And they utilize it sparingly, and they utilize it where they are able to demonstrate that they are, bringing a lot of good to the society, and also to show that they are not causing disruptions that undermine the system. And for all of us around the table, when it comes to governance, all stakeholders, the one thing we should understand is that we all possess political power, and how we leverage this political power by utilizing the capital we have is extremely important. And so where you don't have good governance systems, there are power games, conflicts remain unresolved, there are unclear priorities or mixed priorities, there's lack of engagement, accountability, and transparency. And also, sometimes the policies are non-aligned. I mean, so because of the non-alignment, you don't have sufficient funding flowing to programs that are considered priority, and they are not sustainable. And also then you see that you can't enforce regulation. So governance is at the heart. Proper governance is at the heart of putting in place and implementing strategic purchasing policies in our countries. Over. Okay.
Thank you so much, Nat. Governance is at the heart of implementing strategic purchasing policies. And some of the things that you talked about that could really lead us towards effective governance are having a clear vision, effective participation, the right people should be around the table, accountability, transparency, and predictability. You talked about the fact that there has to be an evidence base. I believe that a lot has been said about that today, DG Parfait specifically. There also has to be a plan for sustainability. And then we should also, while walking through this whole process of how to bring change about, we should be able to demonstrate quick wins. And then there should be that confidence to make decisions, just to move things around very quickly. So thank you so much, Nat. I mean, I could go on with this session, but we do have participants who have already a lot of questions queued and waiting for different participants. So I'm going to take, for the panelists, I'm going to take a first round of questions, and then we'll come back for more. So let me start from this. This question says, do you consider as a low-hanging fruit for Spark the idea of influencing purchasing arrangements at national and subnational health insurance authorities to adopt strategic approaches? Okay, I hope I understand this question. And then goes further to say, it appears that a buy-in by health insurance authorities will most likely influence budget processes at ministries of health. That's a very interesting question. And maybe Nat and Dr. Pierre, you might want to perhaps respond to these ones, to this. Then I also have this other question that says, interesting experience in Rwanda. For countries that do not necessarily feel or perhaps have the strong political will for strategic purchasing, how can they build it? It's almost like, what can we learn from you, Rwanda? How can the coaching approach suggested by Spark contribute to putting strategic purchasing among the priorities of governments? Nneka, I'll leave that second part of the question to you. And then the first part to you, Dr. Parfait. the one that says for countries that do not have the strong political will for strategic purchasing, how can they build it? Teach us something. And then there's also this very interesting question here that says, what evidence informs strategic purchasing? I think I would love perhaps all the panelists to weigh in on this as you're answering the other questions. What evidence in your own experience, in your own countries, really speaks to strategic purchasing? And maybe the final question, so that we can take this round before we come back for more if we have more time. One of the key aspects that Rwanda mentioned is having an evidence-based approach. But having such an approach requires reliable data, and many African countries face numerous challenges in terms of quality of information. What is the experience of Rwanda in addressing capacity gaps in data governance and information systems for health? Clearly, that is for you, DG Parfait, but would also love to have any other panelists weighing on that. So let's start. Nat, do you want to go first?
Sure, Nkechi, thanks so much. And thanks for the question, and thanks to the questioner. And certainly, I mean, when you talk about strategic purchasing, the players are 4 key players. You're talking about, government, you're talking about the purchaser, you're talking about the consumer, and then you're talking about the healthcare provider. So whatever happens has ripple effects throughout the system. And, in regards to what are the low-hanging fruits, I do understand your question to mean, can we do reforms at the health insurance agencies themselves? Yes, it is one of the key things that you can do. Those things, over which those health insurance agencies have control, should be those things that I call the low-hanging fruits that they can deal with. And those have to do with efficiencies within their own system, and also actually changing the complexities that sometimes they impose, which are unnecessary, in order to bring about efficiency. And so in that regard, yes. In the broader scheme of things, if, for example, it's about changing a payment method, you need to involve everybody. And that involvement should actually be driven by the stakeholders at large, because then you have to have buy-in and support for those changes. And as we have all discussed, the way to go ahead is to put the consumer at the center, but also to bring up the issues of sustainability, the issues of quality, as well as the issues of getting, should I say, more transparency and responsibility into the system to come to the fore. I think that's what you have to do. But yes, there are things that can be done by health insurance agencies, to address those low-hanging fruits. But finally, let me say that when it comes to purchasing, certainly it's different in every country. So you don't necessarily talk about health insurance everywhere, because some countries don't have them, but still they engage in strategic purchasing. Thanks, Nkechi.
Thanks, Nat. Dr. Pierre, do you want to go next?
Oui, merci bien pour les questions et observations. Et je voudrais pas répéter ce qui a été dit, seulement ce qui est intéressant, c'est que c'est quelque chose qui est progressif et qu'il n'y a pas une disposition qui est figée, et que le Burkina est dans la dynamique de toujours changer pour atteindre vraiment le niveau optimal. Ce que je voulais ajouter pour la partie concernant le rôle des acteurs, il faut une séparation des fonctions. La société civile, les organisations de la société civile doivent vraiment occuper une place importante dans la redevabilité, la transparence. Et c'est ça qui nous permet vraiment d'avoir un système solide et qui nous permet d'aller de l'avant. Et le financement aussi doit être vraiment des ressources qui sont internes. Si on utilise des ressources externes pour construire un modèle, on est sûr qu'on ne va pas y arriver. Donc, le Burkina a choisi d'utiliser des ressources internes et d'ajouter au fur et à mesure les différents services. Et actuellement, la vision même, c'est d'aller jusqu'au niveau des communautés pour pouvoir réduire vraiment les coûts de facture. Donc, nous sommes dans le processus et au fur et à mesure, nous corrigeons et nous continuons. Merci bien.
Thank you so much,
Okay,
Dr. Pierre. Deja Parfait.
Thank you very much.
I think I'll go next before Deja Parfait.
Oh, that's fine, Emeka.
Yes, so the question I want to tackle is, somebody said, how can the coaching approach suggested by SPAC contribute to putting strategic, I want to believe this is strategic purchasing and not procurement, among the priorities of government? So over time, we've been able to identify the fact that, look, the coaching and mentoring approach used by SPAC is usually, it's deliberate, it's targeted. So those are the principles around their strategies. And so sitting with the country stakeholders, you know, to provide that guidance for you to identify where your problem lies, because in walking you through that, not telling you your problem, so they work with you to identify your problem such that you're able to take ownership of that problem. Because if you understand your problem, then you'll be able to, you know, identify the challenge, the solutions to the problem. And of course, also because of the fact that you're more conversant with the contextual issues, you're also able to identify the challenges and how those challenges can be tackled. So the SPAC community is equipped with providing that guidance, you know, to work with you and walk you through your problem to identify and take ownership of that problem. And of course, also demonstrating regional and cross-country examples and strategies that had worked. Perhaps that can also help to spark that interest, you know, that will make the country key stakeholders to make that decision of putting strategic purchasing as one of government priorities. This has worked in all of the countries that SPAC has provided support for, and it won't be different in your country. And again, like I said, understanding the contextual issue for us to also provide the contextual guidance for you to identify and solve your problem. So that is the approach that SPAC is using and will use to support your country in getting strategic purchasing into as one of the government's priorities. Thank you.
Emeka, do you also want to weigh in on evidence? Because we talked a lot about evidence needed for strategic purchasing. There's a question there, and I have posed it to all panelists. Do you want to speak to that before Deji Parfait now takes it? Nick, I think you're muted. I can't hear you.
Sorry, I didn't know that. Okay. Sorry, please. So in terms of synthesizing evidence, like I said, the peer-to-peer learning strategy is also one of the means by which we have used to galvanize evidence from the region. Yes, we have technical people, but we also have people who can relate to what's happened in countries to source and curate this evidence, which we'll now put together, you know, and share it widely. So most recently, it was around curating the evidence on how countries strategically purchased or did not strategically purchase services or essential services during the high point of the pandemic. And not just that, also identifying with the challenges that they encountered and how these challenges, were tackled. These are pathways through which we curate the evidence that countries can relate and countries can take ownership. And not just that, these learnings, are put in such a way that countries can learn from them. Countries can choose to replicate these learnings based on established and scientific evidence that has been put together. So those are some of the strategies that SPAC is also using to push the paradigm of strategic health purchasing. So also providing that evidence, that the examples that, look, this is evidence-based, it has worked in this and that country, it has worked in this and that context, and of course highlighting it's not all rosy. Countries encounter challenges. We don't sweep that under the carpet, rather we use evidence to highlight these challenges and provide guidance on how these challenges could be tackled as well. Over.
Thank you very much, Nneka. That was very insightful. Over to you now, Deji Pape.
Thank you very much, Keshi. And thank you very much for one of the people in the audience for the question on how we can, just bring the more awareness about strategic purchasing. Let me use that term. So, the person rightly mentioned about the country that's where there is no political will. What the thing I can advise him or her. So number one, it's first gets all the people who are involved one way or another in strategic purchasing, understanding the importance of strategic purchasing to achieve the universal health coverage. I assume that most of the country, all countries have committed to achieve the universal health coverage. So strategic purchasing should be seen in the perspective of achieving universal health coverage, rather than bringing it like one standalone initiative, but it should be well translated or well subscribed in the universal health coverage concept or framework. So from there, everyone on the who is involved in one and another in that strategic purchase, either in the design, implementation, or monitoring of that initiative, should be understanding the importance of implementing strategic purchasing. So from there, you just build that kind of consensus. That consensus people understand. Then there should be some kind of progressively engaging decision makers. So engaging decision makers, there is two ways. Number one, you have to do more advocacy. Advocacy, that means you should make sure that you have built your case. Why should strategic purchasing be designed or implemented in your country in the perspective of universal health coverage, achieving universal health coverage? Then, if decision makers understand, definitely they are the one to take it further to other level. Then you build that what the so-called political will. So I will encourage people, even if you don't see changes, but as I rightly mentioned, it's a journey. It's you go slowly and progressively. Don't take courage and then don't be discouraged and quit that's journey. So because we are all called to be change agents. So the change in the world have started with few people, and then you spread the initiative and it goes all the way. But what matters is you have to build properly your case, and people understand the importance of implementing strategic purchasing what are we losing if you don't purchase strategically? What are we gaining if you're not doing that? So there should be that kind of understanding. Of course, as I rightly mentioned, evidence. It won't be all should be built on the evidence. Either you build a business case, either you build what's called, depending on terminology as people use, investment case, business case, advocacy paper, depending on the name or terminology people can use, but definitely something should be done, and you build a kind of consensus up to the decision makers where big decisions are being made. And definitely strategic purchasing, hopefully it should be one on the day, will be on the menu or the table for discussion. So if you allow, moderator, I'll jump on the second question, the issue of how to address the capacity gap in data governance and information system. So I would say that some few points here. I'll talk about a few points. Number one, it's about identifying the data gap or capacity gap, the data that we governance, data governance, all the way from the health system. Of course, priority should be, or the focus should be on the people who are generating, or the people who are working on those data on daily basis. If you understand why are they collecting those data and understand the importance of the use of those data, definitely they'll be collecting those data with a clear vision or perspective, know what should be coming out from those data that they are collecting, or they are entering in the system. Identifying as well the gaps that are in terms of data, gaps in terms of data, then see how they can address them with the available resources that they have, but also they can also they can also build. I mean, they can also bring other stakeholders on board. People can help them to build those systems. Of course, it should be country-led, not partner-led or donor-led. It should be country-led so that it will become more sustainable in the future. The other thing that it's built for the governance, the data governance and the information system, there should be a regular discussion around data to ensure that the people who are using data, those who are collecting data, the people who are generating those data, but also the people who are making those data being available, putting all the people in the discussion, what has come from the data that they are provided, and then how data have been used, and what are the type of decision that the data has been used for. Then they should be motivated around that, and then there should be a kind of mechanism or a results-based approach to ensure data that is being generated is reliable, it's coming on time, it's coming timely, but as well is accurate. Of course, there is an element of data quality that comes in. So with the data quality, different perspective, you use the different methodology that we have in country, but also other methodology may need to adopt to ensure that data are available on time and they are also accurate. So thank you very much, moderator.
Thank you so much, DG Parfait. I also want to use this opportunity to thank all the other wonderful panelists, Nat, Nneka, Dr. Pierre. We can have this conversation forever. Unfortunately, we're fresh out of time. So I'm going to hand this back to Dare, noting that I know we have a lot more questions. We're going to curate them, we're going to answer them, and we're going to put them up on our website. So please be sure to visit SPAC.Africa. All of those questions and answers will be there. Thank you so much to the panelists yet again. Back to you now, Dare.
Yeah. Thank you very much, Nkechi. That was quite an intense session, and I believe that we all have been able to glean something. I will turn it over to Agnes again as we wrap up to kind of just synthesize what we have heard so far and what we can take home from here. Yeah, Agnes.
Okay, great. So thanks, Dare. Thank you to our panelists, our moderator, for such an insightful discussion. And for those who've been with us for almost 2 hours, thank you very much. I think we've had so much. I don't know where to start, but I'll try. We started with a quote, "Let us be the light in the tunnel because vision requires no less." So I want to thank Al-Safan and Timothy for your spoken word, reminding us why we do this every day and that the decisions we're making will actually impact who lives and who dies, and reminding us that there were missed opportunities even with COVID by not prioritizing UHC before. So we know resources are limited and we'll never have enough, but we can use what we have better. And I think that's what Spark is trying. It's a key message here. More efficiency, being more aware of the stakes and redeeming the narrative and confronting the issues with a business unusual approach. So I'm just going to pick to some of the highlights of how Spark is creating a movement for strategic purchasing, bringing in evidence to change the conversations in country engagements, and leveraging on existing local and regional expertise, as we've heard from our panelists. So what did we hear? One, policymakers face a wide range of tough choices and decisions, and there are trade-offs. And I liked how Nat broke this down, that strategic purchasing of action of maximizing benefits and minimizing risk, and noting who is trying to minimize risk and maximizing the benefits, minimizing complexities of implementation, simplifying performance improvement, and then communicating and acknowledging the interests of the different groups. And once you do this, you'll be able to identify who you need to talk to, who should be at the table, what needs to be done. Now we need to align our policy to politics and generate the political will and political equipment. We heard about the visionary leadership that Rwanda has that puts people first, getting health prioritized and translating attainment of UHC as a development agenda for productive, healthy workforce. So if you didn't have it, there is your plan for taking this forward in your countries. And from Burkina Faso, the president's commitment for free services for women and children and free medicines at health facilities. And even in Kenya with the Big Four agenda. And these political commitments can unlock the potential for ministries of health to advance improvements to health service delivery and make gains on key indicators. We also had the strategic purchasing is about making bold decisions. It's not going to be easy, and there will be backlash. We had about Ghana and the experience implementing capitation, but there's still lessons that they're moving forward with that. And Kenya's bold reforms to improve NHF and reposition it as a strategic purchaser. And to move things forward, we cannot do it alone. We need to align stakeholders. We need to make sure that we have everyone at the table working towards a common vision, pulling together in the same direction. And as Nat said, make sure you have the right people at the table. Don't forget your power brokers as you map out your stakeholders, and make sure that these people at the table are well informed to foster discussions and not to scuttle progress. And Nat also said that, we all have political power and we need to leverage the political power effectively to ensure transparent, accountable governance to implement and improve our purchasing institutions into strategic purchasers. We also had the strategic purchasing is like UHC, a journey. So you need to keep introducing new ideas, evaluating them, iterating, improving, and then starting the cycle again for continuous improvement. You might never actually get there. It's not about a destination, it's the journey. And to be a strategic purchaser, you need data. And I know there are many questions about this, and starting with where you are. And we also heard from DJ Parfait from Rwanda about using data to define priorities, objectives, expected results, and using data to build a case for strategic purchasing, and using evidence to inform country-driven ideas and solutions. And I really liked that, homegrown solutions. So we all know fiscal space is limited. You can't underscore that. But you can start by prioritizing services for the most vulnerable women and children and areas that can have maximum impact or address the broader spectrum of health needs in the population. And we had a very good example from Dr. Pierre from Burkina Faso on the targeting of free services for women and children. And so, just segueing to the business unusual approach, and Dr. Pierre's sharing that Spark is using a different approach to country engagement, applying the coaching approach that NECA also spoke of to identify real country demand to support country-led processes, not parallel processes, and to use regional and local expertise, such as the NECAs, the DJ Parfait, and Dr. Pierre's of this world and Nat. And that we need to bring stakeholders together to create consensus, as we've seen that happening in Burkina Faso to move things forward. So how can we make progress? We don't have all the answers. It will all be contextual, but inertia is also not helpful. Start with where you are and start conversations in your countries. But do not lose sight of the objective, that consumers or citizens, populations get access to good quality health services while reducing financial barriers. And strategic purchasing is a toolbox that can help you advance your agenda towards UHC. So I think SPARC has its work cut out to continue to sustain momentum created today. And I'll leave you again with the last quote that we actually started with. Let us be the light in the tunnel, because vision requires no less. Thank you very much, and I hand it back to Dare.
Thank you so much, Agnes, and thank you so much to all our panelists. Thank you for our attendees. Please visit spark.africa. There are several resources that buttress a lot of this conversation. You can join the coaching and mentoring community and also join the global database of experts. Until another policy dialogue series like this that we will bring your way again, it's been wonderful 2 hours with you, and we really appreciate your attention. My name is Oludare Bodrin once again, and have a great rest of your day. Bye-bye.